Welcome back. It's exactly 9:21 a.m. News and Views on Salam Media. We're now crossing over to the Western Cape, and we'll be talking with Dr. Feroza Amien. She is with the Healthcare Workers for Palestine, South Africa, and this is a call that is gaining traction regarding South African healthcare workers for Palestine demanding Discovery Health to withdraw from the 2024 Leadership Summit over ties to apartheid Israel Ministry of Health. And of course, this is a very, very strong call indeed. Let's hear what progress has been made in this matter by talking with you, Dr. Feroza Amien. You are the EXCO member for obviously healthcare workers for Palestine, South Africa. And by the way, I love your logo. It couldn't have been more appropriate. Salaam alaikum to you. Welcome to the program. And of course, I love the earrings as well. They match your logo.
Wa alaikum salam. Thank you so much, Julie, for having us on the show.
Okay, so how did this all start? When did you guys become aware that this, this is going to be taking place, this summit, leadership summit? I also know that Dr. Faisal Suleiman from KZN, I'm sure you do know who he is, he's the chairperson of SAMNET. They too have put out a very, very strong call regarding this matter.
Yeah. So we literally only found out a few days ago, I think around maybe Thursday, that the summit was happening. And then also who was taking part in the summit, notably the Israeli Ministry of Health, that is a partner organization with the Future of Health organization. And the Future of Health organization is hosting the Future of Health Summit. So we literally only found out, I think, maybe Wednesday or Thursday last week. And our first call to action was to engage directly with Discovery. So we sent him a letter highlighting the problematic collaboration between Discovery and the Future of Health Summit, because Discovery is hosting the summit this year in South Africa at the Mount Nelson Hotel. And we outlined why this is problematic and highly unethical, and we asked them to withdraw from the summit based on the Israeli Ministry of Health and the Israeli government's direct action in a plausible cause of genocide in Palestine. So that was our first port of call, and they responded, and we weren't happy with the response. They refused to withdraw, and also inaccurately said that the Israeli Ministry of Health is not directly involved in the summit, which is not true.
Okay, one of the people that was mentioned by Dr. Faisal Suleiman of SAMNET is suggesting that one of the people that might be attending is also directly linked to the IDF. And we know the horrors they have perpetrated on innocent men, women, and children. And isn't it ironic that Israel, apartheid Israel or Nazi Israel, should want to be on a platform where they're discussing the future of healthcare globally, I should imagine?
And that is exactly the point that we try to raise with Discovery, is that there is nothing that the Israeli Ministry of Health or the representatives that are present at the FOH summit. Some of them are from Sheba Medical Center, which has direct ties with the IDF in terms of medical training, research, collaborators. So they are not even complicit; they are actively involved in this genocide. And it's beyond ironic that they are talking to us about the future of health. There is nothing that they can say to us about equitable healthcare. There is nothing that we can learn from them in this regard, except how to weaponize a health system to commit a genocide. It's
Okay.
laughable.
Absolutely. Obviously, there's going to be international representatives from the North, the Global South, and the Global North. Are we here in South Africa the only country and organizations like yourself, healthcare workers for Palestine, that have taken objection to this leadership conference happening here in our summit happening here? Or I should imagine you would have taken objection to wherever it was being held.
Um, Yes, but I think, especially given South Africa's history of apartheid and how the global outcry and BDS sanctions, divestment, and boycotts helped our situation so much. It's even worse that we are now in South Africa hosting the summit with Israeli partners in our particular context. So, yes, it is highly problematic wherever they are. They do not have any credence or right to speak about the future of health when this is what they are doing to another healthcare system simply to get land. So, it is, yes, it is problematic.
What does it say about South Africans' case, the case that they took to the ICJ regarding all these war criminals? Um, it kind of really, it's such a contradiction. It is such a contradiction that on the one hand, we as South Africa collectively were supporting this call by the then minister, Naledi Pandor, regarding taking this very strong case to the International Court of Justice. And now we're hosting this international summit in South Africa, and Nazi Israel is going to be one of the attendees. And as you rightly say, what are they going to bring to the table?
It is a slap in the face to our government for actually hosting the summit with the Israeli Ministry of Health as a partner organization and with academics from Sheba Medical Center, which has been working with the IDF. So the fact that we have taken Israel to the ICJ and we have tried to do all of this work. We've also handed over an anti-apartheid bill to our government to strengthen our BDS actions, to apply even more pressure on Israel. And then Discovery comes along and just hosts a summit where they are allowed to talk on the future of health. And what Israel has done to the healthcare system in Palestine is a massive, massive part and tool in their genocide. So yes, Discovery has basically slapped us all in the face with
I
this
think what I
involvement.
think what Nazi Israel has done to the Palestinian healthcare system is one of the most serious crimes against humanity. And I think history will then judge them. Sadly, that the global north and possibly parts of the global south are so blinded to all of this double speak by the white supremacist. But be that as it may, what sort of response did you guys, as health workers for Palestine, get from Health Workers for Palestine South Africa, get from Discovery?
So they immediately wrote back to us and basically stated that the I'm actually going to quote you. I'm actually going to quote them. I've got it here. It was a highly problematic response, right? So their formal statement to us was, for clarity, the delegates from Israel attending the Future of Health Summit are administrators and managers of Sheba Medical Center, not the Israeli Ministry of Health. There is no direct involvement with the Israeli Ministry of Health in the FOH summit. And then the email went on to say how we have a lot to learn from these leaders, all of the leaders that are present at the FOH summit, and therefore they are not going to withdraw from the summit. And as I said earlier, it is a highly problematic response. Right. We also sent a similar email to SAPRO, which is the South African Health Products Regulatory Authority. And not only us, several other healthcare workers as well and organizations, because they were also meant to present at this particular summit. And I heard yesterday, in fact, I saw the email for myself, so I can speak to this with credibility, that they immediately withdrew from the summit. And I see
Okay,
Sanders
so
calling for the same thing. Yeah.
all right. So what's the action going forward? Because clearly it seems as if Discovery is not going to put pressure on the Israelis who are going to be attending, or they're not going to withdraw or ask them to withdraw. Do you think you can put enough pressure on Discovery Health to suggest that ask, you know, just uninvite the Israeli delegation to the summit? Because if you don't, it might just collapse. And is there a possibility that the summit could collapse? And do you believe that there are possibly other countries? I'm assuming it's an international summit. So do
Yes,
you
it is.
believe that other countries might then decide to step down, given that Nazi Israel is going to be represented at the summit?
It can actually go either way. It really can. I mean, what we are basically going forward with Discovery, we are continuing to ask that they withdraw, even though the summit is currently underway. It technically started yesterday with a cocktail function yesterday evening, which is why we decided to protest there at 6:30 last night. And so we're still calling on Discovery to withdraw. We are asking that they issue an apology for hosting the summit in the first place with the Israeli Ministry of Health and with attendance from Sheba Medical Center, right? And then also to make a statement on ethical practice going forward, because ethical practice absolutely underscores all health professions and how we manage our patients and how we manage the healthcare system. So from that, from the level of your patient up to the level of your health systems, it has to be underscored by ethical practice. And at this particular point in time, given everything that's happened in Gaza, given our history in terms of apartheid, this is absolutely unacceptable because it's unethical practice from Discovery, and they are not representing all of their constituents. I mean, they are the largest medical aid scheme in the country. I'm a member. I know so many other members. And this, what they're doing, completely contradicts my belief system and the belief system of healthcare workers for Palestine.
Okay, two
So,
issues. Carry on.
no, no, Kaya.
Okay, I've been receiving, I'm on a whole host, as you are, lots of different WhatsApp groups, and everyone is now calling for us to terminate our Discovery, obviously, memberships. People who bank with Discovery should close their accounts, and all the products that they are actually supplying should be boycotted. When does this, and that's a very, very big cry going out. And I know
It
people
is.
are going to be a bit concerned as to, if I cancel my membership now and if I have an medical emergency in my family, I'm really going to be in deep trouble. I think as healthcare workers for Palestine and other such uh, groups all around the country should put out alternatives there for people, because if they don't have an alternative, they're not going to withdraw their membership from Discovery. That's the one issue. When does the summit end? And clearly, our pleas and our requests have not been heard by Discovery. They've ignored us. Once again,
Yes,
we are
yes.
brown and black people and we are invisible as far as they're concerned. What then is the next step going forward?
So I've also heard lots of people calling for a boycott of Discovery and terminating their membership. At this point in time, Healthcare Workers for Palestine is not taking that stance. At this point in time, the issue is under discussion because, as you said, there has to be plausible alternatives. And I would urge, I mean, if anybody at this point wants to switch from Discovery to another provider in terms of banking, in terms of car insurance, healthcare, everything, then it's your imperative. Go ahead and do it, but do make sure that you are covered in that interim. And I do think that if you do cross over to another medical aid, for example, that the other insurance company or medical aid insurance company will ensure that there is a proper period of handover where the person is still covered. But if they're going to do that, they need to double check the fine print and make sure, because we don't want anyone's healthcare to suffer because of this. There's been enough suffering in terms of healthcare in both this country and all other conflict areas around the world. So at this point, we have taken, as an organization, we have taken a decision to continue engaging with Discovery to make sure that this doesn't happen again. And
When does
so
the
for now,
when
that
does
is
the
our next
summit
step
end?
forward.
All right.
The
When
summit
does the
ends on
summit end?
Wednesday.
Okay.
Wednesday.
Is Healthcare Workers for Palestine, South Africa, and other interested parties going to continue protesting outside the venue of the summit?
So there may be informal protests. We are still in discussion about that for today and tomorrow. The problem is time. And the problem is because of time, you need to have a permit to have a massive protest. So and there isn't enough time to be able to organize this. Like I said, we only found out a few days ago, and our first port of call was to engage with Discovery, and we're still hoping to engage with them going forward. But at this point, there are no mass protests planned, but there may be smaller informal ones happening later today, wherever the delegates may be. Yeah.
Okay, Feroza, let me understand. It seems as if our hands are tied at this point in time. The summit has kicked off. It ends on Wednesday, which basically today is half over already. So it's just another day and a half, probably, for the summit to continue. You are continuing your engagement with Discovery. What is this engagement all about? Because the summit has already gone ahead. So what are you hoping for this engagement to, what do you want to achieve out of your continuous engagement with Discovery?
So, firstly, the engagement with Discovery moving forward is more of a strategic move, given that they are the largest medical insurance scheme in the country, and they are going to be a major player in terms of the public-private partnership that will underscore the national health insurance that will be happening in the country. So at this point, engagement, we feel, is better than any other action. And so even though this summit is ending on Wednesday, the point now for raising our voices and continuing to raise our voices is how are they going to handle this sort of situation in future? And they need to know that there are voices out there and voices that are part of their organization that are contracted to their products that have a serious problem with this unethical practice. So, it may not be considered a win now for this particular summit, but definitely going forward, I'd be very surprised if they do not think twice before collaborating with, for another summit or conference or anything where there is engagement and involvement with the Israeli Ministry of Health or any of the Israeli hospitals.
Well done. I do applaud Healthcare Workers for Palestine, South Africa, and other such organizations raising their voices very, very loudly so that Discovery and other such large corporates in our country sit back and realize that there are very, very loud voices and strong support for the people of Palestine. I applaud you and the organization Healthcare Workers for Palestine, South Africa. Allah accept all efforts and guide and protect you all. And may all of our du'as and efforts be truly realized, inshallah. Thank you indeed. Go well, and salam alaikum to you.
Thank you. Wa alaikum salam.
That was Dr. Feroza Amien, EXCO member for Healthcare Workers for Palestine, South Africa. It is exactly 9:39 a.m. News and Views moving along. And next, we are going to be talking with Zweletu Mazibuko, who is a road traffic victim. He is going to share his story with us. And let's hope this is going to be a stark reminder to all road users with silly season having started.
We are here in the middle of a Zahra neighborhood. The whole neighborhood is already destroyed. More than 17 towers are down. Here, as you can see, the firefighters trying their best to help the people are still under the rubble. A lot of the people.
Join Hamza on his exclusive South African tour as he shares his personal experiences, never before seen footage, and powerful insights on the ongoing genocide in Gaza. This is more than just a talk. It's an invitation to witness Gaza through the lens of Hamza Sha'alan. Don't miss this opportunity to meet the photojournalist who brought Gaza's pain and perseverance to the world in its darkest moments. Follow Salam Media on social media pages for more on this tour and be part of the conversation.